Topic: Investigate the correlation between nurse-to-patient ratios and patient safety, mortality rates, and quality of care in healthcare settings. Abstract: This dissertation investigates the impact of nurse staffing levels on patient outcomes in acute care settings. The study aims to assess the relationship between nurse-to-patient ratios and patient safety, mortality rates, and quality of care provided in hospitals. Using a mixed methods approach, the research combines quantitative analysis of patient records and qualitative interviews with nursing staff to gather insights into the factors influencing nurse staffing levels and their effects on patient care. The findings reveal significant correlations between lower nurse-to-patient ratios and adverse patient outcomes, including increased rates of medication errors, hospital-acquired infections, and patient dissatisfaction. Key themes explored in the dissertation include the role of nurse workload, skill mix, and staffing patterns in influencing patient safety and care quality. The study also identifies organizational factors, such as budget constraints and nurse staffing policies, that impact staffing decisions and nurse-patient ratios in acute care settings. Based on the research findings, recommendations are provided for healthcare administrators, policymakers, and nurse leaders to improve nurse staffing practices and enhance patient safety and care outcomes. Strategies for implementing evidence-based staffing models, supporting nursing staff through workload management and professional development opportunities, and fostering a culture of safety and teamwork are discussed. In conclusion, this dissertation contributes to the understanding of nurse staffing issues and their implications for patient care in acute care settings, offering insights and recommendations for improving nursing practice, healthcare delivery, and patient outcomes. Objectives of this study: 1. To examine the relationship between nurse staffing levels, including nurse-to-patient ratios, and patient safety outcomes in acute care settings. 2. To assess the impact of nurse staffing factors, such as workload and skill mix, on patient care quality and satisfaction in hospitals. 3. To identify organizational factors and policies that influence nurse staffing decisions and staffing patterns in acute care facilities. 4. To provide evidence-based recommendations for healthcare administrators, policymakers, and nurse leaders to improve nurse staffing practices and enhance patient safety and care outcomes in acute care settings.